Dr. Dale Carrison. I'm the medical director for Dynamic Stem Cell. Well, I love medicine. I'm somewhat of an oddball in that I didn't go to medical school until I was 43 years old. I truly believe that stem cells are the future of medicine. We don't know anywhere near as much the potential of stem cells as we are going to find out. The potential is here. It's tremendous. We at Dynamic Stem Cell have had tremendous success, particularly with any of orthopedic injuries, orthopedic problems. We've treated multiple areas of concern in medicine, and we've had tremendous success in those. In regeneration of tissue, made tremendous advances in skins with burns, made tremendous advances that's going on now in Stanford with strokes. Japan has made tremendous progress in cardiac. There are areas of the world where they're now treating and experimenting with stroke patients, multiple sclerosis patients, chronic obstructive or pulmonary disease or emphysema patients. It's just a wide area, and it's a wide open field that we look at each patient as an individual. We analyze their problem that they're coming to us for, and then we have discussions with them about what their expectations are, and tell them realistically what we think we can do or what we can't do. And we're totally realistic with every patient. Communication with the patient's first, the medicine is second. So if you have to communicate with your patient has to be comfortable with the procedure or whatever you're doing, because they're going to get better sooner if their confidence in you or your process or your organization that you represent is meaningful to them, because that's human nature. You know, if you hate something and you're trying to make it work for you, it doesn't work nearly as well as if you have confidence in that procedure, you're comfortable with that procedure, and you believe it will help you. And again, we tell you, if we're not comfortable with doing this procedure with you, we'll tell you and we won't do it. And you don't communicate with a patient as a group, you communicate with each patient as an individual. Because of my experience in medicine, after 30 years, I have a great deal of experience with thousands of patients, and I can answer some of those questions that they have, even though they've done research in the area. One, that makes them comfortable with my knowledge, and two, it gives them confidence in our organization that we know what we're talking about, we know what we're doing. We're not experimenting with patients, we're not going into completely uncharted territory. We're confident in the procedures that we provide, and we're confident that we're providing no harm, which is a basic tenet of medicine, do no harm. The relationship a physician has with his patient is more important than anything. It's more important than the medication. And the ability of a physician just to listen to the patient is something special. The insurance companies are ruining that. The electronic medical records ruin that. We're not allowing the physicians to have that patient-to-physician human interaction that we did. We're too busy filling in the forms and clicking on the computer to sit and listen to the patient, which is the most important in my opinion.